financial growth that you get in the pharma industry is much better than what you get in the clinical practice. Professional growth also, if you see, if you work as an associate dentist, you are just going to not going anywhere. But when you come to pharma industry, there is a lot of opportunities. So yes, the financial growth and the professional growth is much better in pharma industry.
Hello, everyone. Welcome to Career in Pharma and welcome to our series of our Career in Pharma superstars. And today we have Dr. Mala with us, and we'll hear from Dr. Mala about her story, how she transitioned to pharma industry after her graduation. Welcome, Dr. Mala.
Thank you, Dr. Neema, for joining me here and giving me this platform to share my success story with all of you.
And thank you for coming here. So, without further delay, let's start. So, we want to know what is your qualification and when did you complete it?
So my qualification is I have done MDS in oral medicine and radiology, which I completed in 2019. And after that, I was doing clinical practice.
Okay. So why did you decide to move into pharma industry? And yes, like you already said, you were into clinical practice. So why you decided to come to pharma industry?
So there were three reasons actually. One, I shifted to Bangalore, and here the opportunities for clinical practice is less, and there is no recognition, no matter how hard you work for that. Second is the financial growth that you get in the pharma industry is much better than what you get in the clinical practice. And thirdly, the professional growth also, if you see, if you work as an associate dentist, you are just going to not going anywhere. But when you come to pharma industry, there is a lot of opportunities. Like you can go and grab those opportunities and grow in your career. So yes, the financial growth and the professional growth is much better in pharma industry. That's the reason I joined this.
Wonderful, wonderful. So Dr. Mala completed her MDS in 2019. After that, she did clinical practice. And then, like she said, because of professional growth, financial growth, she moved into pharma industry. So Dr. Mala, because you are one of our brilliant students, I would say, and I would like to know from you, why did you choose, career in pharma only? There are so many institutes out there.
Yeah, no doubt there are so many institutes, and being in Bangalore, I have been in touch with a lot of institutes, those who provide all the same courses that you give us. But there are few differences that I would like to highlight. The first is when while scrolling the LinkedIn, I came across your webinar and I attended that. And I realized that you personally, and when I spoke to you personally, you gave me the clarity like, oh, what will be like suitable for me, like what I want, and accordingly I joined that course. Whereas when I was talking to other, they were just giving me the list of courses that they provide, not giving me the scope of it, or what will align with my the expertise or something. But you give me the clarity what I should do it, and what has more scope in this industry. So that's the reason I joined CIP.
Thank you for this. And yes, as I always say, not all the courses are suitable for everyone. So we need to always customize it. So yes, Dr. Mala, we would like to know, definitely it's not an easy transition, especially if you're coming from a clinical background. And definitely there must be so many challenges in this journey. So we'd like to know what are the challenges you faced during your transition, both on a personal front and professional front.
So let me start with the personal front. So mentally also it becomes difficult for when you do a clinical practice to accept that you have to go for a corporate since you don't have any corporate experience. And second thing is you have to explain it to your family as well that why you're what you're doing, why you're not practicing dentistry. So that is the challenge that I faced personally. And apart from that, professionally, see again, I don't. We don't have the corporate experience. We don't have that kind of communication skills that we need, and neither we have the Microsoft Excel or Microsoft Office experience. So those are the challenges that I experienced professionally. But these are the challenges that make you like learn and grow in professionally. So that's how I overcame that, and then yeah, I got the job
Mm.
also.
Yeah, so true. Because before professional, the personal challenges are very important to address. Like you said, the mind shift, because that is very important. Being a clinician, you have to, bring that shift in your mind. And yes, family. Yes. So yes, during this conversation, I did not tell our audience that Dr. Mala is working as a medical data reviewer in a reputed MNC after her clinical practice. So I missed that part. So yeah, after this, I just want to know from you, Dr. Mala, that how did you find this job specifically, medical data reviewer, and before that also you were working as a medical data abstractor. About both these jobs, how did you find it, and what kind of support you got from Career in Pharma, directly, indirectly, whatever it is, just tell our audience.
Okay, so my first job that I got in some MNC and as a data abstractor, I got to know it from a WhatsApp group, that the Career in Pharma WhatsApp group we have. So regularly when you post all about all the jobs, and that gave me, when I was going across those opportunities, I came across that data abstractor opportunity and applied for that. And like I said, I got it from the WhatsApp group, and then I contacted you, and then you helped me in building the resume accordingly. And after the resume, we prepared for the interview. You gave me all the questions, like basic and whatever the careers, that role specific questions were there. And accordingly, we prepared for that. And then, yeah, the interview went well. And then, yeah, I got the opportunity. And then, yeah, that was my first job as a data abstractor. And for the second job, I got it from LinkedIn, though. Got to know about the vacancy from the LinkedIn, but again, I spoke to you regarding the opportunity. Then you said, yeah, you can go ahead, and you gave me all the questions again. Those were the required, and accordingly, I prepared for the interview. And yeah, throughout the interview process, also you helped me a lot. Like, what should I speak? How to, the negotiate regarding the salary to HR, and how the interview process is. Everything you explained me very well. And then yeah, again the interview went well, and I got my second job as well as the medical
Yes,
data review.
I still remember, the conversation we had through WhatsApp regarding the important interview questions. So with this answer, I would like to tell all our audience, because when they, look forward for job inside pharma industry, they straightforward, they don't apply for other roles. Like you worked as a medical data abstractor. Now, many will not go for this role because their focus is maybe just some big CRO or pharma. But I should say this, that the medical data abstracted role, the role which you did, Dr. Mala, definitely that also helped you a lot. I mean, I want to hear from you how working as a medical data abstractor helped you to getting this opportunity and clearing the interview as
So before telling me that, I would like to tell one thing that you told me on the very first call when I told you like I've got this opportunity. You told me like it is better to get into this industry no matter the what role you are getting. So if you get into this industry, this experience is going to help me. And yeah, that sentence is true. That this data abstractor role, I got to learn about oncology, a lot of oncology or new drugs I got to know. And when I transitioned to this medical data reviewer role, there, when I was giving interview, they asked me about that role a lot. Like what I have learned about oncology, or what I got to know about other drugs, what are the new drugs, how this clinical trials work. So all these I got to know my from first role. So that's how that my first role helped me to clear my interview for the second role.
So true. Just to tell all our audience, whenever you are, focusing to get a job inside pharma industry, pharma companies, or any big CRO, before that, if you can get this kind of roles, that's going to help you a lot. So never say no to any opportunity, even though you don't want to do the job. Just for interview exposure, please grab the opportunity, because even getting interview call is not easy task, right? So yeah, with this, Dr. Mala, we all would love to know How do you feel about yourself now?
Honestly, much more confident. Because see, when you don't have job, or initially when you get a new job, you're a newbie, you get anxious and everything. But over the period of time, you get confident. You get to learn a lot of things. You get training and everything. The amount of corporate experience eventually you get, and the most important, the financial growth and the professional growth you get, that gives you a lot of confidence and clarity in your career also. So yeah, much more
So
confident now.
true. I totally agree. The confidence which we get, I always say, if you have that money, that financial stability in your life, automatically that confidence comes. Uh, yes, money is not everything, but yes, you can buy each and everything which makes you happy with the help of money. So
Right.
that's how it makes you confident. So now the last question is, Dr. Mala, uh, any message or one piece of advice you would like to give all the freshers who are looking for job inside pharma industry? Because many times we have more than 5,000 alumni in our career in pharma. We know how tough is the job market. Not
Right.
everyone will be able to get job easily, so sometimes it takes time. They get demotivated in this entire process. So what advice you want to give to those people?
Getting demotivated, yeah, it's normal, it's human thing. But the thing is, if you work on yourself, I would say work on yourself. That is the most important thing. The mentorship and the course that you have selected, the career in pharma is definitely going to help you in getting the job, but you have to work on yourself first. Work on your communication skills, work on the things that you think that are going to help you in getting the job. Prepare for interview every day. Don't wait for the call to get, or like, interview call to get. Prepare for it every day so that you don't panic when you get the call. You will get the call for sure.
Yes, I 100% agree with this. You have to be prepared always. You don't know when you're going to get the opportunity. And then, like Dr. Mala said, you can't panic, right? Because then when you are in a panic state, your interview not going to go well, and then you are not selected. So yes, and very important, communication and work on yourself. Because no matter how much you are good in your knowledge, in corporate, non-clinical sectors, for that matter, even clinical sectors, communication can take you to the next level. We all know this. Yeah. And no one talks about this in college.
That's the sad part, actually.
And such a big, irony it is.
But then those who want to go for corporate, the communication skill is the key.
True. True. 100% I agree with this. And thank you, Dr. Mala, for coming here. And we wish you all the best. I mean, from entire career in pharma team. And, wish you all the best in whatever you do. And we would love to see, students like you, our career in pharma superstars, achieving heights and milestones and, making their career and making us proud and making your family also proud. Thank you once again for coming here.
Thank you, Neema ma'am. Thank you for sharing this platform with me and showing faith and giving me this opportunity. Thank you all so much.
Thank you. Thank you, Dr. Mulla.
थैंक यू फॉर वॉचिंग दिस एंड मैं आप सबको ये बताना चाहती हूँ इस स्पेसिफिक टॉक शो से, डॉक्टर माला की जर्नी से, आई हैव लर्न 3 थिंग्स अदर देन हर डिग्री, हर नॉलेज। 3 चीज़ें, 3 बातें मुझे बहुत अच्छी लगी। वो ये थी, डॉक्टर माला इज़ ऑलवेज रेडी टू ग्रैब एनी अपॉर्चुनिटी। तो उन्होंने मेडिकल डेटा रिव्यूअर की जॉब के पहले मेडिकल डेटा एब्स्ट्रैक्टर की जॉब ली, करी। उनकी जगह कोई और होता तो शायद मेडिकल डेटा एब्स्ट्रैक्टर की जॉब को रिजेक्ट कर देता, एंड समवेयर वो मेडिकल डेटा एब्स्ट्रैक्टर की जॉब ने ही डॉक्टर माला को हेल्प किया मेडिकल डेटा रिव्यूअर की जॉब पाने में और इंटरव्यू क्लियर करने में। दूसरी चीज़ डॉक्टर माला की मुझे जो अच्छी लगी इज़ कि उन्होंने बोला कि वर्क ऑन योर सेल्फ। येस, चाहे आपको कितनी भी नॉलेज हो, कुछ भी हो, आपको अपने ऊपर काम करना पड़ेगा। आपको पता होना चाहिए कि आपके अंदर क्या कमी है। वो कम्युनिकेशन भी हो सकता है, सॉफ्ट स्किल्स भी हो सकता है, यस आपकी नॉलेज भी हो सकती है। तो आपको अपने ऊपर तो काम करना ही पड़ेगा। और तीसरी बहुत अच्छी बात डॉक्टर माला ने बोली कि बी रेडी ऑलवेज, बी प्रिपेयर्ड ऑलवेज। आप वेट नहीं कर सकते कि जब कोई अपॉर्चुनिटी आएगी तब मैं प्रिपरेशन करूँगी, क्योंकि अपॉर्चुनिटी कभी भी आ सकती है और उस वक्त आप ना नहीं बोल सकते। सो बी रेडी फॉर इंटरव्यूज ऑलवेज, बी प्रिपेयर्ड, and definitely one day your day will also come. So with this, thank you for watching this talk, our Career in Pharma Superstar Talk show. और ऐसे ही टॉक शोज with our Career in Pharma Superstars will be coming with more talk show, जहाँ पे आपको हम अपने Career in Pharma Superstars की पूरी जर्नी ट्रैवल कराएंगे, so that you can understand what all it takes to get a job inside pharma industry. So once again, thank you for watching. We'll meet soon. Till then, have a nice day. Bye bye.